we are speaking about today on a trans-pterygoid approach. Now, trans-pterygoid approach is something which is highly specialized. Now, if we see, there are 5 to 6 levels in our learning curve for endoscopic sinus surgeries. Trans-pterygoid somewhere lies between level 4 and level 5. So one of the most advanced approaches which are available today is a trans-pterygoid approach. Trans-pterygoid approach are basically used for having access to Meckel's cave tumors or lesions arising in Meckel's cave, or in petrous temporal, petrous apex, petrous temporal bones, petroclavian meningiomas. These are the tumors which are easily accessible through the trans-pterygoid approach. We also have access for chondrosarcomas or chordomas, actually transclavial, but chondrosarcomas predominantly for trans-pterygoid reaching near the ITF. So to clear those tumors of trans in the ITF, predominantly rhabdomyosarcomas, these are the ones which are of most use. What is trans-pterygoid approach? Trans-pterygoid approach corresponds to the approach which moves around the pterygoid bone and pterygoid base. I am Dr. Snehal Shah. I am an endoscopic skull-based surgeon based in Mumbai. Now, coming to the pterygoid base, pterygoid plates, the tumor which are arising or are in closer proximity to this is what we approach through a trans-pterygoid approach. For us, the most important landmark is a spinopalatine artery. So once we get the spinopalatine bone, spinopalatine artery is dissected, the arterial branches are ligated. Once they are ligated, then we have access towards median nerve. Median nerve, again we'll have access towards the foramen rotundum, where we have maxillary nerve. So what we call is a river. It's RVVR. That's how the pattern is on both sides. RVVR, foramen rotundum, foramen rotundum from which comes out the maxillary nerve, the median canal. V stands for median canal, from which comes out the median nerve. So we have to go beyond the median nerve and the foramen rotundum, through which comes the maxillary nerve. Now once that is accessed, we drill out the bone which is present between the petroclavial ICA that we define and the sphenoid bone. So what we drill out is also a empty space of foramen lacerum, beyond which, so once we start from foramen lacerum, we have access to petroclavial ICA. ICA stands for internal carotid artery. Once that is drilled out, we drill out a triangular bone between the petroclavial ICA and the pterygoids. So the pterygoid base, the pterygoid process is drilled out, and that's how we get an access towards Meckel's cave. That's how we get an access towards infratemporal fossa, since this also helps us to have access towards the pterygopalatine fissure. Once that is done, we have access towards the ITF. Once we get the access to the ITF, we can not only have access towards tumors, but also for, sometimes it can also be used for those tumors which are squamous carcinoma going to the ITF, but close to the close to the pterygopalatine fissure, where we can have this access, remove the tumors without much blood loss. So trans-pterygoid approach nowadays is one of the most important approaches. We combine this with two more approaches. We combine this with either a Danker's maxillotomy at the same time, that is what we do, we remove the anterior wall, or we can of the maxillary sinus, or we can also have access towards from the contralateral side of the maxillary sinus corresponding to canine. We make the entry into the bone. From there we have access towards the pterygoids. So a contralateral CTM, contralateral maxillary sinus approach, or we can have Danker's maxillotomy combined with trans-pterygoid to give a vast, huge amount of exposure. Not only can we take care of petroclavian meningiomas, we can take care of rhabdomyosarcomas, we can also take care of cholesterol granulomas as well. So multiple tumors we can take care of. So all the pathologies around petrous apex is what we can access. More so, apart from that, we can also have an access towards the internal auditory meatus, and we can have access towards those tumors. Now to know more about this, such an exciting approach, kindly follow my